So let's talk about something absolutely critical to your dental practice in Malaysia, your professional signature. And I'm not talking about how you sign your name, I'm talking about your patient records. With the new Malaysian Dental Council guidelines that kicked in on January 1st, 2024, getting this right is no longer optional. For you students, think of this as the foundation of your entire career. And for supervisors, this is the gold standard you have to uphold.
I want you to pause and really think about this for a second. If your work was ever put under a microscope, by a patient, by the board, by anyone, would your records be the thing that saves you, or would they be your biggest liability? Because when things get serious, the quality of your notes can make all the difference.
All right, first up, we need to completely change how we think about patient records. It's so easy to see them as just paperwork, right? A chore you have to get through at the end of the day. But that's a huge mistake. They are the very cornerstone of your professional practice. They say everything about the quality of care you provide.
So, what exactly is a dental record, according to these new guidelines? Well, the definition is probably a lot broader than you think. It is not just the patient's chart. It is any piece of information related to their care. That means every single x-ray, every study cast, every clinical photo you take, it's all part of the official legal record. And it all needs to be handled with the same level of care. This right here is why it all matters so much. Your records are a direct reflection of your standard of care. Yeah, they're obviously essential for good treatment planning, but just as important, they're your main medical legal document. You've heard the saying, if it wasn't written down, it never happened. Well, it's true. Your records are your proof, your evidence, and very often, your absolute best defense.
Okay, so we know why they're so important. Now, let's get into the how. The guidelines lay out some really clear, non-negotiable principles for every entry you make. Think of these as the fundamental rules of the game. I like to call these the 5 golden rules of record keeping. First, your notes have to be clear and legible. Ask yourself, could another dentist pick this up and understand it enough to safely treat the patient? They've got to be factual and accurate, just the objective findings, not your personal feelings. They must be contemporaneous, which means you write them on the same day. Why? Because your memory isn't perfect, and notes written weeks later just don't hold up legally. And finally, they have to be permanent and accountable, meaning every entry is dated and signed by you.
Look, mistakes happen. We're all human. The important thing is knowing how to fix them properly. The guidelines are super specific here. You never, ever use correction fluid or scribble something out. Instead, you put a single, clean line through the error so you can still read what was there. Then, you write the correction nearby and you initial and date it. This shows you're being transparent, not trying to hide something.
And of course, we have to talk about confidentiality. This one is absolutely non-negotiable. It's your legal and ethical duty to keep these records secure. That means in a locked cabinet for physical files or behind a strong password for electronic ones. Only people who are authorized should ever be able to access them. Period.
All right, let's get into the nitty-gritty. The guidelines actually break down a comprehensive patient record into 10 key components. You should really think of this as your essential checklist for every single patient file. So the first 5 are all about gathering the right information. You've got the basics, like personal information, then the chief complaint, and this is so important. You have to write it down in the patient's own words. Don't paraphrase it. Then you need a thorough history, a detailed clinical examination of everything you find, and the results of any investigations you perform. This is how you build a complete picture of your patient.
The next 5 are all about action and documentation. Based on everything you've gathered, you make your diagnosis. From there, you develop a treatment plan, making sure to note that you discussed risks and costs. Then comes consent. This isn't just a signature on a form, it's documented proof that you had a proper conversation. Your progress notes tell the story of each visit, and finally, exit notes officially wrap things up when treatment is complete.
Okay, so you've created this perfect comprehensive record. Now what? You can't just file it and forget about it. Managing that record over its entire life is just as important as creating it. Let's walk through that life cycle.
When it comes to charting, the rules are simple and clear. Every single new patient gets a full odontogram on their first visit. If a patient comes back and has been more than a year since their last charting, you need to do a new one. This makes sure you're always working with the most current information.
And how long do you have to keep these records? These aren't suggestions. This is the law. For adult patients, it's a minimum of 7 years after their last visit. Now, for children, it's a little different, and for a good reason. You have to keep their records for 7 years after they turn 18. That's because they can't take legal action until they're adults, so the clock starts much later.
This little timeline really helps visualize the whole process. The countdown starts after the patient's very last appointment. For the next 7+ years, that record sits in secure storage. And only after that minimum period is over can you get rid of it. And by dispose, I mean securely, shredding, incinerating, not just tossing it in the recycling bin. You have to protect that patient's privacy to the very end.
So as we start to wrap this up, let's bring it all back to the main idea here. This is all about your professional responsibility. These guidelines aren't just red tape. They are the framework that ensures we all practice dentistry with accountability and excellence.
Remember this date, January 1st, 2024. As of this day, these guidelines are the standard. This is what your work will be measured against. For students, you need to master this from day one. And for supervisors, you are responsible for making sure this standard is met.
I'm going to leave you with a quote taken directly from the guidelines, because it's just that powerful. Failing to prepare is preparing to fail. At the end of the day, your dental records show how prepared, how diligent, and how professional you are. So ask yourself that question again. Are your records an asset you've carefully prepared? Or are they a failure waiting to happen? The choice is entirely yours.